Good morning everyone. Good morning UK, good morning world, or good evening depending which part of the world you are. It's Steph here, and today I'm gonna do a live about diabetes. This is going to be part of my diabetes series. I've done the thyroid series and I'm doing now the diabetes series, and it's basically aimed at sending out information there to people who are affected by any of those disorders, to make sure that you get the facts as they're supposed to be, as opposed to a lot of noise that you find online, biased information or totally incorrect information. And of course, at the moment, when it comes to diabetes specifically, the information you get from GP is completely wrong as well, which is contributed to the massive epidemics we're having at the moment. So my aim in doing this live is to get as much information out to you guys as possible, and hoping that it will help you, manage your disorders, so that you can get a better quality of life, and also a better, more longevity, because let's be honest, diabetes kills. So today what we're going to be covering is the 3 types of diabetes. So yes, there are 3 types. It's not just type 1 and type 2. I'm going to cover the causes, what causes them, the symptoms that you get. Some are very common, some are not quite particularly known. Treatments, how they treat it, what the best treatment is, both based from what NHS does and based on what you should be doing, and finally the consequences. So starting from different type of diabetes. So we got diabetes type 1. Type 1 diabetes is basically, you're born with that. So it's diagnosed very early in early childhood, and what happens basically, your body just can't produce insulin. You do not have these beta cells in your pancreas, who are the one responsible for producing insulin. You just haven't got them. Or if they got too little amounts and they can't produce enough insulin to keep you alive. And basically, if you haven't got insulin, your body eats itself. That's basically what happens. You lose lots of weight until eventually you die. So it's serious consequences. So that's typically diagnosed in childhood. And the treatment for that at the moment is insulin injection. Then you got type 2 diabetes. Type 2 diabetes is the one that everyone knows about. Type 2 diabetes is not an issue of insulin deficiency. Your body can produce insulin. This is where a lot of people get confused. And this is where it drives me mad when people just blame their genes, because type 1 diabetes, if you're born with that, is generally genetic. There is a genetic component. Type 2 diabetes, there is a small genetic component. So if somebody in your family's had it, chances are they passed on the genes to you, so you are more predisposed to develop it. It does not mean that somebody in your family's got type 2 diabetes, you get type 2 diabetes. You will get it if you eat crap and you don't move. Absolutely, you get it. But that's up to you. That's your choice. So the genetic component type 2 diabetes is only 50% or less. So stop blaming your genes, people. Your genes, I've got crappy genes. I got genes for autoimmune disorders, for bad thyroids. I don't blame them. I managed to control everything through diet and exercise. So you can do that. So just be clear about that. Type 1 diabetes, you're born with that. That's it. It's lack of a draw, and you're born with that. If you can't produce any insulin, you're stuck. But type 2 is totally manageable, is even reversible. And unfortunately, type 2 diabetic are not told that by the doctor, because for the doctor it's easy to dispense the medication. So what's the difference? Type 2 diabetes is actually insulin resistance. So what does it mean? Your body can produce insulin without problem. However, because of bad eating habits, namely lots of processed foods, sugary stuff, alcohol as well, so all of these things, your body keeps on having glucose thrown into that. So carbohydrates contain glucose. So every time you eat something that contains glucose, your body has to produce insulin to get it out of your bloodstream. In your bloodstream, your body can only tolerate up to 5 grams of glucose. That's like a teaspoon of glucose. So the moment that goes higher, it becomes toxic. So your body has to defend itself and shove all this glucose, extra glucose, into your cells. That's sometimes your muscles will need that. It's stored as glycogen, yeah. It's stored in the liver, it's stored in your fat cells, you know, it's stored in different cells. So the body uses glucose for main fuel, yeah, for energy. So that's what the body does. However, if you have too much glucose coming in, it comes to the point where the cells are full of glucose in the form of glycogen, and they say, that's it, no more, we can't take anymore. Yeah, because if the cells take too much glucose, they become ill. Yeah, so they become inflamed, and eventually they start dying. Yeah, and causing lots of problems. So they say no more. That's when they become resistant. So they become resistant to your insulin. So the insulin is the hormone that goes in, knocks on the door of the cell, say, here you go, I've got a portion of glucose for you, and they say, no, sorry, there's no vacancy left here, we can't take anymore. And therefore the insulin can't put the glucose into the cell. So, and what happens over a period of time, it takes a long time for you to become insulin resistant through bad diet, yeah, eating too much, overeating. There's a lot of that going around, yeah, because we eat not because we're hungry, we eat because it's there, we find it there, and we go for a coffee, then we get a muffin with that, even if we're not hungry, you know, it's just habits, bad habits. And so when over a period of time your cells become more and more resistant to the insulin, then eventually the glucose in the blood cannot be put in the cells anymore, so it starts rising. So when it starts rising, then the doctor says, oh, okay, you're pre-diabetic. But by the time you're there, you're done. You're insulin resistant, been insulin resistant sometimes for years. Yeah, so the doctor tells you you're pre-diabetic. Okay, this is what you got to do: change the diet and do this thing. Unfortunately, the diet the doctors give you is 55% carbohydrate. I mean, that's the very thing that causes insulin resistance. Yeah, I mean, too many of them, yeah, because especially when you're not moving. So instead of making it better for you, it compounds more problem, because you eat all those carbohydrates. They say whole grain is good for you. No, it's not. If you're diabetic, whole grain, white makes no difference. Yeah, so you stay away from that. And you have that one, you have a whole grain rice, your whole grain pasta, whatever might be the case, because it's good for you, your whole grain cereal because they're good for you. Yeah, you have those ones, and what happens? The insulin to come out again, but the cells are not taking anymore. Yeah, so eventually from pre-diabetic you end up diabetic because your level of glucose keeps rising. Then the doctor says, now we can give you medication. Yeah, and that's how the doctor deals with that, and I'm going to cover in a second why the medication doesn't help. So the problem with type 2 diabetes, it is that while it's 50% or less genetic, the other 50% is purely down to bad diet, yeah, processed food, sugary stuff, even fruit, fructose, too much fruit. I mean, some people, these days people make these smoothies. They put like 6 different pieces of fruit inside that. No. You know, if you eat a piece of fruit, you'll just eat an apple. You wouldn't eat an apple, a bunnet of berries, some oranges and some more stuff, 4 or 5 different types of fruit. You wouldn't do that. So why you do it in a smoothie? That's not good for, that's a huge amount of sugar. Yeah, it's natural sugar, fructose, but fructose is actually being linked to high triglycerides. High triglycerides are some of the causes high cholesterol, yeah? So high triglycerides then are some of the precursors for cardiovascular disease, yeah? So lots of fruit is not good for you, yeah? So the moderation, you need to bring it right down. If you're diabetic, I would say stay away from fruit anyway, because you don't need that, yeah? So bad diet, yeah? Eating too much, which is what we do. We eat every 2 or 3 hours, because obviously when you're having so many carbohydrates, you get hungry all the time. They make you hungry, especially sugars make you hungry. Yeah, and then you need to eat more and more and more. Yeah, lack of exercise, because lots of people sit down in the office all day for 8-10 hours, then we go home, we sit down for another 3 hours, and then we sleep for the rest of the time. Yeah, so that's where the problem is. And some medications make you insulin resistant as well. So just be aware of it, guys, that if you are on steroids, and now steroids are given for various reasons, they're often given for autoimmune disorders. Yeah, unfortunately, an autoimmune disorder is one of the other things that can be fixed through diet. You know, unfortunately, the doctors like to dispense medication. Most of the medication got serious side effects that while they fix one thing, they cause damage somewhere else. So steroids and statins. Statins are medication doctor will give you for high cholesterol. Yeah, and again, the definition of the doctor of high cholesterol, it's, you know, completely wrong, but that's a different life. So when you're given statins are known to cause insulin resistance over a period of time. Once you're insulin resistant, then you're type 2 diabetic. Yeah, so it's not just the genes, it's not just the bad lifestyle, lack of activity, the bad diet, it's also some medication. So when a doctor gives you medication, yeah, ask them, what are the side effects? Yeah, because if they give you medication and if they give you statins, for example, because they say your cholesterol is a bit high, well, there's 5 different type of markers on the cholesterol. If the total cholesterol is high but the HDL is good and the triglycerides are low, then you haven't got cholesterol problem, but the doctor will give you a pill because on the tick box it says if it goes above that, the total, they have to give you a pill. That pill will make you diabetic. So not only doesn't fix the cholesterol because you haven't got a problem with the cholesterol, but it makes you diabetic in the process. Yeah, so always ask the doctor, what are the side effects? Is it worth me taking the pill and end up with diabetes? Do I really need this pill? Yeah, of course, if your cholesterol is really, really bad, you're at high risk of heart attack, you have to take the statin. But if you change your diet, then you will be able to come off the statin and you won't get diabetic either. Yeah, so that's type 2. Now there's another type called type 1.5 or LADA, which is latent autoimmune diabetes in adults. Yeah, what basically is something that unfortunately is starting to become on the increase as well. It's type 1 diabetes, but for adults. When I mentioned before, type 1 diabetes is normally diagnosed early in life because you can't produce your insulin. You haven't got the cells in the pancreas to produce insulin, so you're very ill very quickly. So when you're a child, you're diagnosed immediately. Something is very wrong and they can diagnose you immediately. However, later in life, it could be in your 40s, in your 50s, 60s, you can develop type 1 diabetes, which is known as type 1.5, because the adult version of type 1. What causes that? Now, what causes that is an autoimmune reaction. Yeah. So what happens is your immune system, very often you got leaky gut, so that causes leaky gut causes food particles to go through your the gut lining and end up in the bloodstream. The immune system does what it's meant to do, which sees particles that in the bloodstream say, oh, this shouldn't be there, I need to destroy them, mount a attack on this particle. But unfortunately, then it scans the body to see similar particles. Yeah, and often is either the thyroid, or it could be the joint sometimes, or it could be your pancreas. So it finds certain similar particles to the food that is found in the pancreas, in the B cells, are the cells that produce insulin. So what it does is starts attacking those cells, and over a period of time, yeah, what will happen is you haven't got enough cells, or it completely destroys all your B cells, and all of a sudden you can't produce insulin anymore. Yeah, and you become type 1 diabetic. So again, for type 1 diabetic for adults, called 1.5, is you don't produce enough insulin because your B cells in your pancreas have been destroyed by your immune system. It is an autoimmune disorder. Yeah, there is genetic predisposition for that as well, because very often autoimmune has got genetic predisposition already, and there's not usually a connection with the leaky gut. And in particular, leaky gut, one of the major problems for your gut that causes leaky gut is gluten. Yeah, so that's why I always say, whether or not you're celiac, get that gluten out of your diet, because if you not celiac, doesn't matter, it will eventually cause damage to your gut. Food particle will go through, you end up developing an autoimmune disorder. You can get any disorder. Yeah, it could be type 1.5 diabetes, it could be rheumatoid arthritis, it could be lupus, it could be celiac disease like me, it could be Hashimoto, it could be Graves' disease, it could be anything. Yeah, you don't know which one you're gonna get, depending, which one your the immune system's gonna attack. Yeah, so as it go. To recap, you got type 1 diabetes is normally found out when you're young. So when you're a child, you're born with that. It's insulin deficiency, so you cannot produce insulin, full stop. Yeah. Type 2 diabetes is insulin resistant, so you got too much insulin, you've been producing it for too long, but your cells in your body have become resistant to the insulin. They just don't want to get glucose inside anymore. They're refusing to take that, and then your blood sugar increases, and eventually you become insulin resistant, and then eventually you become diabetic as well, type 2 diabetic. And it's all partly down to genetic, but mainly down to lifestyle and lack of activity. Yeah. and some medication will cause that. And type 1.5 is the type 1 of adulthood, yeah, when you're through leaky gut and through inflammation in your body mounts an attack, gets confused, attacks your B cells in your pancreas that produce insulin. All of a sudden you can't produce enough insulin, or you can't produce it at all, yeah, and then you become type 1.5 or type 1 diabetic for adults. Yeah, so what are the symptoms? Now, a lot of the symptoms are common to both types of diabetes, all three types of diabetes, 1, 1.5 and 2. Namely, they are excessive thirst. Yeah, so you get thirst. It doesn't matter how much you drink, you thirst all the time. If you get all of a sudden your thirst changes and you're constantly thirsty, you need to ask yourself a question. Unless you had a very salty meal, yeah, there's a problem. Yeah, frequent urination, and it's not just because you drink a lot more, you just need to go all the time. Yeah, you feel weak and you feel fatigued. Yeah, so very often type 2 diabetics find that they have to have a nap in the afternoon because they're exhausted. Yeah, common thing is hunger. Yeah, you're feeling hungry all the time. Yeah, so those are all similar common factors. Type 1 and type 1.5, so the type 1 for children and 1.5 the type 1 version for adults. The major difference is that you have a sudden unexplained weight loss, but drastic. Yeah, you just start dropping weight for no reason. You're eating the same thing, you're doing the same thing, and doesn't matter how much you eat, you keep on dropping weight, but drastically and very, very fast. Yeah, we all know that when you have a sudden drop of weight, if you haven't changed your diet or anything different, there's always something serious in the background. Yeah, sometimes it can be cancer. Yeah, and sometimes it can be type 1 diabetes, whether it's adult version or child version. So the type 1 and 1.5 diabetes, unexplained weight loss, that's the first alarm bell that should get you think something's really, really wrong here. Yeah, and then of course excessive thirst, urination, constant hunger, feeling weak. Yeah, that's type 1 and 1.5. Now type 2 diabetes actually is different, because type 2 diabetics often are overweight, sometimes obese. Yeah, and if they're not overweight, they will be called a skinny fat. So they look skinny on the outside, but they got very high body fat content. Yeah, ratio, and often is because they store centrally where the waist is, and that's where you start getting insulin resistance. Sometimes, not often, they may have fatty liver. Yeah, so the layers of fat outside the liver have reached a certain point that cause the condition called fatty liver, which is quite serious. Yeah, and can become even cirrhosis of the liver. So it's very serious condition, so it needs to be dealt with. Same thing, you got the frequent urination, but you got other symptoms, like very common with type 2 is very slow healing wounds. You know, you have a cut, it takes forever to heal. You know, those are warning signs. You know, you get blood vision sometimes, you get frequent skin infections, numbness in the legs. Is when diabetes starts having an effect on your peripheral nerves. Yeah, neuropathy, and the fatigue. So there's a very big difference. So if it's a sudden weight loss, you're looking more towards type 1 diabetes, and you still got excessive thirst, urination, tiredness, you know, weakness, hunger, you know, is all there. But if you're overweight and you store centrally, or if you're a skinny fat, yeah, you look skinny, but you're actually very floppy, so you've got high body fat content, slow healing, numbness, skin infection, blood vision, the hunger, urination, all of those, yeah, those are the symptoms of type 2 diabetes. Yeah, so how do we deal with this? Now, at the moment, type 1 and 1.5 are treated with insulin injection. Yeah, those are the type that can't produce insulin at all, so they have to have immediate insulin, you know, injected. And type 1 diabetic and type 1.5 as well need to dose, you know, it's not just one dose for everyone. They need to dose the insulin based on how many carbohydrate they have in the meal. Yeah, isn't this interesting that type 1 and 1.5 diabetes, they're insulin deficient, they cannot produce insulin, so what the doctors do, they give you insulin, correct, because they need that. And then the more carbohydrate they need, the more insulin they need. Yeah, doctors know that, diabetics are told that, so we know that diabetes and carbohydrates are linked. Yeah, so reduced carbohydrate to minimize the amount of time the insulin is going to come out to deal with glucose. Yeah, so but type 1.5 diabetes are going to be insulin dependent. There is no way out of it. Although there's a clinic in Hungary called Paleomedicina, you can check it out, Google it, who have had very good results with type 1 diabetics as well, where they've been able to control the type 1 diabetes through the Paleolithic ketogenic diet, which is mainly meat-based diet with organ meat and everything, and very often very little, if none at all, vegetables, yeah, carbohydrates. So they've had very, very good results with that. However, is the caveat is that once type 1 diabetic go on that diet, they have to stay on that. If they come off and start having carbohydrate, they're back on insulin, yeah, of course, because they can't produce insulin. So, you know, the moment they eat carbohydrates, they have to have insulin, yeah. But type 2 diabetes, this is where it doesn't make sense. Just think about it. Type 1 is insulin deficiency. You just haven't got enough insulin. Yeah, you can't produce insulin at all, or you produce too little. Yeah. Type 2 diabetes is insulin resistant, so you actually can produce insulin. You got no problem producing insulin, but your cells are saying no more. Stop with this glucose. We cannot take anymore. You're making us ill. Yeah. So what is the way that we should be dealing with that? Well, is you need to stop having carbohydrate or reduce the amount of carbohydrate drastically, so you don't get so much huge amount of glucose in your bloodstream that the insulin has to try to get it through the cells, yeah, because cells are not taking anymore. Yeah, so to lower your blood glucose, you need to lower your carbohydrate. Don't eat them every single meal. Maybe eat them once a day and concentrate on vegetables rather than grains and cereals and bread and all that kind of crap. Yeah, no. What do the doctors do? They give you insulin. But hold on a minute, you've got insulin. Your cells are resistant to insulin. So why would the doctor give you insulin when you've got enough of it? It's very simple. Because you've got insulin, your body produces insulin. Your insulin is not strong enough to push the glucose into the cells. Yeah, because the cells have had enough. They're saturated, yeah, with glucose. So by giving you more insulin, you're literally bulldozing the glucose into the cell. You say you're going to take it whether you like it or not. Yeah. So metformin, the medication that in the UK is given to most diabetic, is insulin. Is given to people who've got too much insulin, more insulin. Is the equivalent of giving somebody who's got a celiac disease gluten and then giving them a medication so you don't get the pain, but you're still eating gluten because you know the damage. Yeah. So, and in addition to that, they tell you, oh, we give you the pill. So, because what does the pill do? By pushing the glucose into your cells, whether they want it or not, it's going to lower your blood sugar. So the doctor looks at that, oh, the blood sugars are fine, that's great, excellent. You just cause damage to the cells. You put glucose in the cells that are saturated. They're going to become inflamed and eventually going to start degenerating. Yeah. And what is that doing is making the diabetes worse and worse and worse. That's why diabetics who don't change the diet and just rely on metformin, yeah, they get worse. The dose of metformin has to increase all the time. They find that the blood sugars don't stabilize. They start creeping up, yeah. Metformin does not fix type 2 diabetes. It makes it worse. And what's most important, people don't understand, metformin does not prolong your life at all. If it makes diabetes worse, what do you think it's going to do? It's going to shorten it. Yeah. So taking metformin if you're type 2 diabetic and following the guidelines in UK, which is 55% carbohydrates, you just, you know, it's ridiculous. You're eating the very thing that's causing glucose, high glucose level in your blood. Yeah, and then take more insulin to shove more of the stuff in your fat cells and all the other cells that they can't take anymore. And little by little, stuff starts breaking down. Guess what? You know, your kidneys start packing up, your eyesight starts going. Yeah, the amount of your limbs, you know, little injuries on your toes, all of a sudden you got gangrene developing. Yeah, your body is in such a high state of inflammation, and there is a reason why the cells in the body become insulin resistant, because the cells in the bodies know that too much glucose will inflame them and will eventually kill them. Yeah, so it's a self-defense mechanism the body has, that once a cell can't take, is full of glucose, yeah, and you need to burn that before you can take any more in, and we're not moving enough. That's inactivity is one of the major problems with diabetes, type 2 diabetes as well, and obesity, that the cells are saying, no, we can't take anymore. That's the body's self-defense mechanism. What do? We say, we go around it. We say, okay, we give you medication that will bring down the barrier and cause the very thing the body's trying to avoid, that's death. Yeah, so that's the one thing, the difference between type 2 and type 1 diabetes. Type 1 diabetes, you haven't got enough insulin, so you need to take insulin. Yeah, type 1, type 1.5, yeah, the adult version. Type 2 diabetes, you've got insulin. It's because you're eating too much, too often, too many carbohydrates. There's too much glucose going through your blood. Yeah, and when there's so much glucose through your blood, then your insulin is called out to deal with that. The cells can't take anymore. They shut down. The shutters come down. They say, we can't take anymore. Doctor, instead of telling you, cut back on your carbohydrate, go back, hi Sue, go back or go on a lower carbohydrate diet. Just eat vegetables, the good vegetables, some of the starchy vegetables. Don't go on all this grain, bloody processed stuff. No, they don't tell you that. There's a pill for you. That pill will get you closer to disease and to death. You need to change your diet, please. That's the only way to deal with type 2 diabetes. Type 2 diabetes is totally reversible. Insulin resistance is reversible. It's reversible through good diet, low carbohydrate diet, yeah, eating real food, not processed food, and activity. 30 minutes of activity a day, get your heart rate up, plus at least 2 to 3 weight bearing session, weight lifting sessions, resistance training session, whatever you want to call them, to get your muscles working as well at the same time. Yeah, this is where the problem is. So consequences of diabetes, right? I've already mentioned a few of them. Yeah, whether you're type 1 or type 2 diabetic, if you are under, if your diabetes is not under control, typical consequence, amputations. There are 7,000 amputation, over 7,000 amputation a year in the UK for type 2 diabetes. There are over 25,000 deaths through diabetes in the UK, and they're increasing. These are old figures. These are over year-old figures. Yeah, so they're actually increasing all the time. Yeah, diabetes kills. You can get kidney failure. You can get heart disease. Yeah, as I say, frequent infections. You get high blood pressure. You get nerve damage. And you are exhausted. You can't function because you're tired all the time. Yeah, but the severe consequences, yeah, are really the losing limbs. Those are things that are life-changing, life-altering. Losing a limb, if your kidney failures, oh my God, kidney failure is, if somebody can donate, find a kidney donor, fine. Otherwise, if you got total kidney failure, you're dead. Yeah, blindness. Imagine how that would affect you. Is all of a sudden you can't see. I mean, that's major. Your whole life changes. Your life for your family will change, and all of this can be avoided. Yeah, so with type 1 diabetics as well, you got the risk of hypoglycemia, diabetic coma. Yeah, and that's normally caused if they're not eating. Type 1 diabetic are the ones that need to eat more regularly. Yeah, to control the glucose level. If it goes too low, it can go into the diabetic coma. Also need to be careful when they exercise and when they're taking the insulin. Yeah, too much insulin or too much exercise can cause hypoglycemic coma. So they've got the problem because they can't produce insulin. They can actually go in hypoglycemic coma, so they can die. That's one of the consequences. Yeah, if you're not careful with how much insulin they take and how much they do and how little they eat. But type 2 diabetes, this is so fixable. This is really, really, really fixable. And if you got type 1.5 diabetes, which is the autoimmune version, you really need to go on a very, very, very strict autoimmune protocol diet, because that will stop the immune system attacking your pancreas, yeah, and the cells in your pancreas. The ones that have been destroyed, yeah. But if you have still got some of them producing insulin, you can stop it from causing total destruction of the cells, which means you might be able to come off or at least reduce your insulin injection as well if you type 1.5 through correct diets. Yeah, but type 2 diet, exercise, lifestyle intervention, those can totally fix it. You can come off medication, you can get your life back, but most importantly, you can avoid the serious consequences that will change your life for good, forever, but in a bad way. Yeah. Okay, so I hope you guys found this useful. So the 3 types of diabetes, symptoms, how to spot them. The most common, as I said, frequent urination, massive thirst, but difference between type 1 and type 2. Type 1, you lose weight all of a sudden, unexplained, very, very quickly. That's one of the big signs. And type 2 is tend to be overweight normally, but if you're not overweight, you can be skinny fat and still have type. If you store centrally where your waistline is, that's where the bit where you put on lots of weight, and you're having a high carbohydrate diet, I would suggest that you check your blood sugars regularly, because your insulin resistance kicks in fairly quickly, but you can be insulin resistant for years before your blood sugars start going up. But the moment your blood sugars start increasing, yeah, if a doctor tells you pre-diabetic, forget that. You are diabetic, because by the time you're pre-diabetic, your blood sugars are starting to go up, yeah, then you've been insulin resistant for years. You have to go on a low carb diet immediately. Yeah, and there is if you look now, there's been various conferences and various talks in parliaments as well with experts. They've gone there to present the fact that it is the current guidelines in the UK that are causing problem both for obesity and for diabetes. And even Diabetes UK have run a massive study with type 2 diabetics. They put them on a low carbohydrate diet, yeah, and they managed to reverse 40 to 50% of these people have completely come off medication, and most of them have stayed off by staying on the diet. Yeah, so it's big consequences, reduction of medication or totally coming off medication. Yeah, so because remember, the metformin is not right medication for type 2 diabetics. You're saying, why does the doctor say, give me that? Because the doctor only fixes symptoms. It doesn't fix the cause. The cause of type 2 diabetes is insulin resistance. The symptom is high blood glucose. Yeah, so doctor give you a pill to fix the high blood glucose. Never mind, in the background is absolutely destroying your body and your cells, but it fixes that. Yeah, it fixes that. It fixes literally just the glucose. It does no good. It's the cause. The cause is insulin resistance. So it's very, very important that you address your diet immediately, because by the time the doctor tells you that you are pre-diabetic, you are already outside of the normal parameters. Yeah, 20 to 40 on the HbA1c, the 3-month glucose test, yeah, tells you what the average glucose has been for the last 3 months. 20 to 40 is classed as standard, acceptable. But they don't tell you pre-diabetic until you're 42, and don't tell you diabetic until you're 48. Hello. I mean, those ranges that the doctors use for blood tests, for any blood test, what you gotta remember when you look at those ranges, you don't want to be too low, you don't want to be too high, you want to be somewhere in the middle. That's optimal. Yeah, so the moment you're above 30, you're starting to have problems there. Yeah, so I mean, something is creeping up. When you come up to 40 and every time you look at it, it's creeping up, you got a problem. There's insulin resistance in the background that's starting to raise your blood sugars. You should take action immediately, but the doctor won't do that until you go well outside of the range, because then they can give you a pill. Before that, they can't give you a pill, so they say you're fine. Yeah, so just remember this. And when you give a medication, please always ask, what is the side effects of this? We know that steroids and statins cause insulin resistance, yeah, over a period of time. So if you have to take them because of another condition and there is no other way around it, yeah, fine. But steroids are often given to people who got autoimmune disorders, yeah, to manage their pain and manage autoimmune. Autoimmune disorders can be fully managed through diet. The autoimmune protocol. Actually, no, I've got 2 of them and I manage both of them through diet. Yeah, so you don't need the steroids. Yeah, steroids make you put on weight on top of everything. They make you hungry, and they give you insulin resistance. Hello, you know, where's the benefit? Yeah, but again, is a pill to fix the symptoms other than something to fix the cause. You have to fix the cause. And type 2 diabetes, the cause is insulin resistance. So fix that with a good diet, yeah, and activity. You have to be active to burn the glucose you're eating, yeah. Stay active all the time. Then your insulin resistance will come down. You become insulin sensitive, which means that your body can take the insulin in. The cells in your body can accept the insulin, and then you haven't got a problem anymore. Yeah, that's all it is. Okay, so that's what I got to say today, guys. I'm trying to keep it short as possible. I can see some people there. I can see Annie. I can see Sue. If there was anybody else there. Oh, Jeanette, I can see. James, there's a few people there. If you're still there, thank you for joining me. I hope you find this helpful. If you know anybody who's diabetic, type 1, type 2, or type 1.5, please pass this on so they get some more information. Hopefully will help them as well. If you got any comments, please put them in. Any question, feel free to comment, and I'll aim to answer that. And if you need any support, whether you are diabetic or whether you know somebody who's diabetic and need support through exercise and nutrition plans, yeah, that's what I specialize in through my personal training and my nutrition therapy. So I deal with diabetics, type 1, type 2, type 1.5, obesity, as well as autoimmune disorder and thyroid dysfunction. So reach out if you need any help, personalized help with your diet and with your exercise, and or depending what you want to do, and I can help you there. Okay, so have a great day. First day of the week, so hopefully the rest of the week is going to be good for you guys, and I'll do another live next week again, going a bit more details with diabetes, and hopefully I can help you more there. You know, as I say, my aim is to give as much information as I can, get the information out to people who need it, so they can start making the changes that you need, and you don't get confused with all this you know, riffraff going around in the internet that is confusing and very often is wrong. Yeah, okay, have a great day and see you all soon. Bye.